Hello and welcome. Stefan Hartman here, Iron Direct Primary Care, bringing you my lecture on weight loss, peptides, and medicines. Let's jump right into it. Why is this important? Because weight loss will save your life. We know weight loss predisposes to increased rates of cardiovascular disease, death, hormonal abnormalities, besides the obvious issue with body composition imaging. BMI measurements give a false sense of health. One of the most important things we need to watch for is visceral fat, so the fat that you have on your abdomen. That is what is associated with incidence of cardiovascular disease and heart attacks. It's a factor for all-cause mortality in men. Cortisol, it is a stress hormone. We need this hormone. It's not a bad hormone necessarily, but I see it all the time disrupted. Patients aren't seeing sunlight throughout the day. They are utilizing caffeine throughout the day. Caffeine spikes cortisol. Patients are very stressed. This leads to a highly cortisol or highly catabolic nature. Patients are also using a lot of steroids long term. These not the steroids that make you stronger. These are the catabolic steroids like prednisone and so forth. This increases water retention. It increases fat. That's what cortisol does if it's highly elevated long term. That's why at Iron DPC we measure 4-point salivary cortisol to see where this is in our patients. Testosterone. Both men and women need testosterone. Lower levels of testosterone affect the psychological state. Obviously, this is going to involve lower drive to work out, less drive overall. I see a lot of times that women have low testosterone and men have low testosterone. And we need to optimize this through dietary methods, supplementation, and at certain ages we do need to do hormone replacement. Estrogen, we see a lot of estrogen excess in both our male and female population. And this is associated with a lot of issues for both men and women. Increased risk of cancer, for example, increased water retention, weight gain on that abdomen, where that central fat mass, you see that on someone, that's usually associated with a higher level of estrogen. And it's a vicious cycle of high estrogen, suppression of testosterone, increase of fat mass, and it's very difficult to break this cycle. And this is why obesity is such a huge problem in the US, and I think it's driven by a higher level of estrogen. DHEA, this is referred to as an anti-aging drug, is a hormone, a precursor hormone to all the hormones. It's associated with a decline in age. It declines with age, and so there is some thought that supplementing this as you age can help prevent a lot of issues related to age, such as poor muscle mass, obesity, and so forth. Hypothyroidism, so low T3. Unfortunately, my colleagues out there are not testing for T3. They test only at TSH, and this leads to millions of Americans and people around the world suffering with undiagnosed hypothyroidism. And low thyroid will make you feel tired, low energy. You're going to gain weight. You're just going to feel kind of bad with low thyroid. We need to support thyroid function with nutrients, right? Vitamin E, selenium, D, zinc, all these things. Now, these are the thyroid tests you want to look for. A free T3, reverse T3. You want to look at thyroid antibodies, obviously the TSH, T4, all these things, and look at it put it into perspective. Look at the patient. Does the patient match what you're seeing? Does the patient look clinically like hypothyroidism? Does their lab really match up with what you're seeing? And so you can't really just treat the patient based off of lab results. You have to also listen to how they're feeling. I see a lot of times patients out there get told you're normal. They're overweight, they're losing their fingernails, they're losing their hair, and their normal is, free T3 is 2.3. So they're right there on the cutoff. They're considered within the normal reference range, but who cares what the reference range are? We're looking at a patient here, not a number. So that's my take on that. Inability to convert T4 to T3, yeah, super common. A lot of patients out there on Synthroid. Synthroid is a hormone that's only T4, and this is goes under the assumption that patients have a functioning thyroid that can convert T4 to T3. T3 is the active hormone, And so we got millions of patients on Synthroid there, and they still don't feel great. They got low energy, losing hair, fatigued, overweight, and they just sit around on Synthroid for years, not getting any better. In my practice, I like to use natural desiccated thyroid that actually has the active component of T3. I know there's naysayers about that. They say there's a short half-life. Okay, yeah, we can optimize that. We can dose it more times throughout the day. But the point is, you got to treat your patient. You can't just go with numbers and protocols. Everyone's an individual. There's some nutrient sources we can use. Selenium is a good one to help that conversion, help repair thyroid. There's a lot of good nutritional animal-based sources for selenium. What else do we have here? Yeah, desiccated thyroid extract. Here's a little bit of a discussion on that. Yeah, it's from porcine, very commonly. And insurance even covers this in natural thyroid or Armour thyroid. Very commonly available. Even Walgreens has this. It's not something super specialized. Let's get into the peptides. So semaglutide, also known as Victoza, Ozempic. You've probably heard of the news on Ozempic. Ozempic is very cool because it is the only drug that I'm seeing that's actually cardioprotective. So it actually protects patients at risk of heart disease. It's amazing. But it helps them lose weight. Absolutely brilliant. And ignore the black box warning that says it causes cancer. It doesn't cause cancer. It's a GLP-1. It's a natural peptide in the body. And it works through improving insulin sensitivity. Improving sensitivity helps patients lose weight, but it also decreases appetite. So it works by that method as well. So patients are going to eat lower calories over the weeks. So once weekly injection. They start out with a 0.25 milligram injection subcutaneously in the fat once a week, and you increase that up to about 1.4. I've seen studies up to 2.4 milligrams weekly. And you continue that for quite a few weeks. A lot of the studies are over 7 weeks, up to, I've seen 30 weeks, 40 weeks on this medication to see the clinically significant weight loss effects with this. There's combinations, semaglutide with levocarnitine. I've seen that with some pharmacies. Carnitine is known to help mobilize fat for fat burning. So very cool to see that combination there. I don't know how useful that is though. Carnitine, you need to get at least 6 grams of carnitine a day to start getting that conversion rate. Obviously, you can get that from animal source foods if you are eating animal source foods. Fortunately, if you're a vegetarian, vegan, you're usually not getting enough carnitine, so you should do supplementation with that. Injectable form of carnitine is a pretty efficient way of getting it into the system, but it does need quite frequent dosing. Oral supplementation is also available. Growth hormone. So let's talk about growth hormone first, and we'll get into more of the peptides. So growth hormone does have some issues with it. Obviously, it's a powerful medication. It's used to help treat Turner syndrome in genetically susceptible individuals, help them grow. The issue with growth hormone is that the pituitary releases growth hormone in pulses, mostly a large part of it through the night. Growth hormone, it's very effective, but I wonder how natural it is to get a sudden dose of it rather than the normal pulsations throughout the day and night. But growth hormone, you can't knock it. It's very effective. And unfortunately, it is quite a controlled substance. So unless patient has a diagnosed growth hormone deficiency, kind of difficult to make the case to prescribe this to patients. Now brings us to the peptides. These growth hormone releasing peptides like sermorelin here. Similar to the growth hormone, these are amino acid chains, and they help tell the pituitary to start making more growth hormone. So, we know growth hormone declines with age, and all these things that we associate with normal aging, right? Decreased bone density, decreased energy, decreased cognition. We potentially could treat this and reverse this instead of letting someone decline with age. So very cool, these GHRH peptides out there. We're going to go through a couple of them because there's quite a few out there. Sermorelin studies Usually it takes quite a while for sermorelin to take effect, as from what I'm seeing. Not one of the strongest peptides out there. One of the oldest ones, though. This thing was, I think this came around back in the 30s, and it was created by a company at the same time as actual growth hormone. And sermorelin was kind of left in the dust because growth hormones was a lot more powerful to actually treat Turner syndrome. So sermorelin, the patent expired on that, and now compounding pharmacies can buy this in bulk and sell it to us at a really affordable rate. Another one here is CJC 1295 ipamorelin. Very interesting combination here. Another growth hormone releasing peptide associated with decreased body fat, improved sleep quality, increased cognition, quicker recovery times post-injury, increased muscle mass, increased strength. So very cool. CJC ipamorelin. A lot of bodybuilders will use this thing, but obviously this is going to have a huge impact on someone who has obesity, who maybe doesn't have that energy and that drive to get to the gym. They're not seeing that muscle mass increase, so CJC ipamorelin can be very helpful for someone with obesity. MK677 ibutamorin. This is an orally available compound. I think I've seen it injectable too. It's another one of these growth hormone releasing peptides. Very interesting. A lot of these improve collagen synthesis. So you have someone maybe losing their hair, skin thinning. Very interesting. You see in studies, especially on elderly patients, their skin gets thicker. You know how the elderly people, you look at their skin and it's so frail. It looks like a wet paper that can break. And I can't tell you how many times I had to tape an old person's skin back together in the urgent care after a slip and fall. Absolutely terrible to see this collagen wasting as people age. These growth hormone releasing peptides show the promise of helping improve collagen. So super cool. Ibutamorin, more on that here. Ibutamorin resulted in a significant 1.8-fold increase in 24-hour mean growth hormone levels and a 1.5-fold increase in serum IGF-1 levels. Body composition increases in fat-free mass, lean mass, and thigh muscle area were observed at 12 months. So very cool. IGF-1 LR3. So this is another one. IGF-1 is a highly anabolic hormone released in the liver as well as peripheral tissues in response to growth hormone so that a new muscle can be built. The main work with IGF-1 is to build muscle tissue by promoting nitrogen retention and protein synthesis. It differs from the original IGF-1 in that it possesses an arginine instead of glutamic acid, blah, blah, blah. So, again, this is another growth hormone releasing peptide. Patients in obesity, they tend to have a lower growth hormone in the first place. So you can measure this. This is what I do pretty commonly in my practice. I measure an IGF-1 in my patients, and I see if they have a clinically diagnosable adult growth hormone deficiency. This is often, you see this in elderly, and you see this in the obese patient. And then using something like these can help, hopefully, kickstart back that growth hormone, and they can start retaining more muscle and hopefully balancing out that predominant fat tissue. More on that here. So here's a protocol for example, ipamorelin. A lot of these have protocols written out by the pharmacies, unfortunately not FDA approved. So there's protocols that pharmacies have set out based off their their batch. So reconstitution is with 6 mL of bacteriocytic water. Inject 10 units in the AM and 10 units in the PM. You also do not want to oversaturate the pituitary, and doses of over 100 micrograms per injection does that. Plus, they do not see a higher spike in growth hormone. You do not want to spike insulin around the time of these injections. No carbs 2 to 3 hours pre-injection or 30 minutes post-injection. So yeah, very interesting. This one I found very interesting. South Lake Pharmacy has this one, kind of a topical one. I don't know too much about this one, haven't used this. I just thought this was kind of like an interesting one. Obviously this is kind of experimental, but I'd be interested to see if this could help some patients. Very cool. Tizofenzyme. Man, I can't even pronounce these. This one I'm not so certain about. I haven't used this one yet. I worked in psychiatry, and we know that certain psychiatric medications do have a tendency towards weight loss. This would be specifically Wellbutrin. Wellbutrin is well known to help with weight loss. So this tesofensine may be working in a similar way towards weight loss. Low-dose naltrexone, that's another one I like to use pretty extensively in my practice. It helps improve insulin sensitivity. So lowering fasting insulin can help patients lose weight. LDN can enhance growth hormone to normal levels. So very cool. We can do that with peptides too, but maybe LDN can do that to some levels as well. LDN modulates cravings for unhealthy foods. I've seen this actually in real time in my practice. Put a guy on this one, and he suddenly no longer had the desire for alcohol. Didn't interest him anymore. Yeah, you're going to lose weight if you cut out alcohol. So LDN does that. It blocks. It's actually used. I use that in psychiatry at very high doses, like 50, 100 milligrams for substance use disorder, opioid use, alcohol use disorder. But low-dose naltrexone I found has a similar effect against alcohol use, but without the negative side effects of using it at 50 to 100 milligrams. It's also an anti-inflammatory. Inflammation is associated with worth T4 to T3 conversion. So yeah, I use LDN in my autoimmune thyroid diseases pretty extensively for that reason, but it also helps reverse and calm down this hyperactive immune response in many patients. Let's talk a little bit about nutrition when you're on these items, right? So if you're on a growth hormone releasing peptide, growth hormone itself, LDN, you still can't neglect the diet. So we've got to cover that here. I've talked about low carbohydrate, high fat diets and their usefulness towards weight loss. But recently I've been noticing that long-term use of these diets can actually affect the hormones. Very interesting. So sometimes patients can have worsening sleep. Sometimes patients can have a lower testosterone with this, can affect thyroid. So very interesting here. Obviously, they do work, these lower carbohydrate, higher fat diets for weight loss for some patients, and I've seen it work. But I would still monitor parameters on these patients, testosterone especially in men, and thyroid levels, because I have seen some abnormalities with these long term. But overall, a diet that consists of good carbohydrates and high quality fish, meats, that's going to be the best thing you want to do. Fish is excellent. Has a lot of nutrients that you need for burning fat. So these B vitamins, B12, choline, carnitine, you're going to get that from animal sourced foods. Sure, you can inject these things and they'll help with weight loss, fat metabolism. But if you could just get into the diet, that'd be a lot better. But no, for patients who, they don't like the texture or can't eat it for some reason, sure, we can talk to pharmacies, we can get compounded B vitamin complexes for injection. Because you do need these minerals, these vitamins, these amino acids for fat metabolism. As I said here, carbohydrates, I believe, are necessary. So an elimination diet, carnivore elimination diet, a ketogenic elimination diet, vegan elimination diet, I think that's great for like a short term, like getting someone off the standard American diet and trying something like that, trying something like radically different. I think patients are going to immediately notice a benefit, and they do. I've seen it in clinical practice. But long term with these diets, they run into hormonal abnormalities. So not something I recommend long term. We avoid processed carbohydrates, the Snicker bars, these breads that stay on the shelf at Publix for 3 months and don't expire. Like, how do they do that? That's not natural. Subway sandwiches, absolutely toxic. Chick-fil-A, garbage. Don't want to be doing that. A good carbohydrate would be better. So anaerobic progressive resistance training on weight loss. This is why Iron DPC, Iron Direct Primary Care, is the way it is. The iron is integral towards what we do. You have to lift weights, especially if you are on a growth hormone releasing peptide. You're going to have growth hormone. You want to put it to use. You want to start stimulating your muscle to grow bigger so that you can replace some of this fat. Right? Fat weighs about 80% less than muscle, but takes up more space in the body. So you want to replace that fat with muscle. That's the first thing you want to do. High intensity interval training. So unfortunately, just walking doesn't really cut it. I get patients to come to me and say, I say, what sort of exercise do you do? They say, well, I walk at Walmart. I'm like, well, how's that working for you? And they say, well, it's not really working. I'm 340 pounds. So I think there's something to it. You know, sure, it's diet. There's a lot of things that go into that, but there's something to be said for progressive resistance training and higher intensity interval training. Just simply walking in my clinical practice, I haven't seen it be very effective for patients. I know a lot of people say walking is the best thing for you, and sure, it's better than nothing. But if you can add on a little bit more, I think that'd be a lot more helpful. So high intensity interval training on testosterone, there is an association there. You can optimize your testosterone with doing that sort of training. Sunlight and vitamin D. You need sunlight. It's a precursor hormone, essentially. If you have a low vitamin D, your testosterone is going to be lower. Your growth hormone is going to be lower. You're going to be unhealthier. Your immune system is going to be suppressed. You're going to have higher inflammation. Higher inflammation is going to lead to more water retention. Higher inflammation is going to disrupt your thyroid, your hormones. So you need sunlight. You need to actually get out in the sun, not wearing sunscreen, and get there for 40, 50 minutes a day at midday and get that sunlight on your chest. Do it. You can supplement it. I mean, if you're working long hours, you're working night shifts, you gotta supplement, but ideally, sunlight would be the best thing for you. Here's more on resistance training for testosterone. Men and women will benefit from resistance training. Just, for the simple fact that you want to turn your body from a Prius into a Ford F-150. You want to make yourself gas inefficient, right? If you're obese. Right? The obese nature is to conserve energy. What you want to do is you want to improve that muscle mass. That's going to burn more calories throughout the day. And that burning more calories is by proxy going to help you lose fat. Right? If you can make yourself energy inefficient, that's what we want. Gas is $5 again here. You want a Prius. But for your own physique, you want to be the Ford F-150. Full body workout enhances testosterone. Yes, it does. I just find it also more efficient for a time management perspective. So hitting a workout maybe 2 or 3 times a week, chest, back, supersets, legs, back and chest, combining those together, it's going to be more time efficient than trying to hit, an arms day, a chest day, a biceps day, a back day, a leg day. No one has time like a bodybuilder to go hit it 6 days a week. It's not practical. You need to utilize your time. You need to be intense with your training. I don't want to see you on your phone at the gym. I don't want to see you shooting the bull with your colleagues at the gym. I want you to get into the gym, get into your training, and really hit it hard. Short rest intervals, high intensity training, and that's going to give you the most bang for your buck when you are training. Training will also help with cortisol normalization. Here is a picture of myself where I did carnivore for 1 week. So I eliminated all carbohydrates. And what happened at that time is I lost a lot of water weight. And my physique really showed. It was absolutely amazing. But this isn't something I do long term. I know long term this would be harmful to my hormones. I like to keep my testosterone very high. I'm not going to suppress carbohydrate. I think my diet is, I'd say 30% carbohydrate, 70% protein. So I still do protein leveraging. Protein leveraging is what I recommend to my patients for fat loss. So that's eating more protein and more protein throughout the day because, one, that's more difficult to digest. For example, if you drink smoothies, if you eat processed foods, this is really easy for you to digest, and that goes into your bloodstream a lot easier as sugar gets converted into fat. So I don't recommend drinking your calories. I don't recommend doing a lot of pureed foods. You want to eat real foods, fish, meats, complex carbohydrates, right? So squash, potato, berries, fruits. Fruits aren't bad necessarily. I mean, you don't want to make your whole diet fruits. You want to cycle your fruits with the weather. If you're in Florida and it's hot outside, great. Fruits are great. You need to have that. If it's in the wintertime and you're in Pennsylvania, it's December, are you really going to eat a banana? It's probably not what your ancestors would have been able to do, right? Maybe they would have found a berry. So I think there's something to that with cycling fruits based off the weather and the climate that you're in. But for the most part, protein leveraging, it's going to be great. You're going to get the amino acids. You're going to get the B vitamins you need, the choline, carnitine, all of these things that help mobilize fat. You're also going to make it more difficult on your digestive system to break down these things for energy. So there's a lot of reasons to do a higher protein diet, but not entirely eliminating carbohydrates, just to make that clear. Hope you all enjoyed this lecture. Very cool peptides. We pretty much covered pretty much everything about weight loss here. And yeah, I'll see y'all next time.